Khairat literally means charity in English and Wema in Kiswahili. It was founded by Kilifi community leaders with the aim of providing affordable services to the Kilifi community regardless of ethnic or religious background. We are happy today to have Sheikh Sharif Salim with us here, as he was a committee founder of Khairat in 1997. It started as a small clinic with only one room at Mtaani. In 2000, when I came to Kilifi, they approached me to assist the clinic operation. At that time, I was committed to Kenya Medical Research Institute, KEMSE, and I couldn't offer my services to the community I couldn't offer my services to the community. And during the weekends with Dr. Maimuna and being at the facility full time. In 2013, I realized that I could no longer balance my commitment at KEMSE and the clinic. Therefore, I decided to resign and become a full-time employee at the clinic. And at that time, we had only one farm tech and one reception. Within 6 months, we managed to move to a bigger facility which had 5 bedrooms, and we recruited more staff to be 15. And that time we had a laboratory, we have a radiology, a maternity wing, male and female ward. And for 7 years, we conducted our activities until 2020, when we moved to our current facility. We are now 3 years old here in this hospital, and it has 20 rooms, and now we have 85 staff members. The rest of the service we provided have been explained by our operation manager. We attribute our achievement to the dedication and hard work of our trustworthy staff, good managers, and the contribution of our partners. Despite transforming from a community-based facility to a fully fledged level 4 private facility, we continue to uphold our mission and vision of providing affordable and effective services to the less fortunate in our community. These values have made Khairat a unique institution in our county. Our current focus is on helping the elderly above 65 years. We recognize that when someone retires in this country, everything, including medical cover, expires. Unfortunately, when everything expires, it's like an immune system where everything goes low, and then at that time the chronic problems and diseases arise, such as hypertension, diabetic and arthritic, depression, and even malnutrition. These result to elderly facing numerous challenges in obtaining medical treatment. As the saying goes, that a journey of 1,000 miles begins with a single step, Khairat Medical Hospital noticed increased demand in the community for medical help. As an institution, we believe it is our duty to assist our community. Therefore, we have initiated KEMSE, a project specifically designed to provide medical treatment to the elderly aged 65 years and above, regardless of race, religion, creed, and gender, at no cost. Elderly individuals would come as far as Mtondia, which is more than 5 kilometers, or Shariani, on foot, hungry, tired, and on top of that, no money to pay for treatment. Therefore, we decided to come up with this project. We started with 50 registered members, and due to high demand, we now have 150 registered members and 646 recruit pending membership. This has become overwhelming for us, as we incur a cost of around 200 to 300,000 per month on just treatment. It has come to our attention that we need to reach out our national and county government partners and friends to make this noble act as a success and extend our impact beyond Kilifi County to the neighboring counties and Kenya at large. As we continue with this program, we get a chance to interact with the elderly at a personal level, and their stories are heart-wrenching. We hear stories of neglect from children, and some have been suffering for many years without any hope of healing. We are moved by their experience and feel the need to share. As demand increases, we feel even stronger urge to help, but unfortunately we are faced with challenges that tie our hands. Challenges like fare issue. They cannot afford to come to the facility just because they don't have fare. Our facility face congestion because we normally schedule them 50 to come every 2 weeks. When they encounter with other clients who comes for treatment, the place becomes congested. Funds for medication, and now we have noticed majority of them, they need surgical cases. Challenges in conducting home visits. They give us their number, but if we contact them, sometimes the number is for their son who is in Nairobi or son in Mombasa, and it becomes difficult to trace their homes. Despite all these challenges, we have managed to offer 3 surgeries, as you have heard from our operation manager. We also observe some of them with eye issues, including cataract, which requires surgeries, chemotherapy treatment for those diagnosed with cancer. However, we continue to receive more and more cases that require our attention. Khairat has also launched a project to help orphans. We currently have more than 5 orphanage schools who receive treatment at our facility at an affordable rate. We also have a disability program, and our orthopedic and rehabilitation center has helped many patients by providing services and preventing them from traveling as far as Kijabe or Portrees. I think Mr. Joseph, our orthopedic technician, was here and talked about this. We have also initiated a home-based program for patients who cannot afford to come to the hospital. We visit schools and provide free medical camps to assist the community further. Distinguished guests, we are proud to have a professional staffs, from support staff to well-trained reception, insurance and billing personnel, pharmacists, laboratory technicians, nurses and clinicians, doctors and consultants, including a well-trained security personnel. These are my staff here, and I would like you to clap for them. They are everything for this institution, not Daktari alone. These are the team. Thank you very much. Our staff's commitment goes beyond caring for our patients. This has led us to receive recognition award for positive patient outcome at our facility, including being recently recognized by the Turkey Foundation Holistic after successful circumcision camp, during which we performed the procedure of more than 2,000 young male adults at no cost. We have also partnered with international insurance company, Europa Assistant from Spain, and we also value so many partners who have contributed a lot, and we had a very good relationship with them. These include Mombasa Cement, Motrix, Kilifi Estate, SGA, KK Security, Kilifi Vonworld, Helping Hands, Kimawasco, Pathcare, Instapath, Lancet Lab, North Coast Medical College, and Good Vision, to name the few. We have also accredited with insurance companies like NHIF, Britam, CIC, AAR, Old Mutual, MTBA, and those waiting on the list are Madison and Jubilee. I'm wondering what are they waiting for to join this great institution. Dr. Hassan, we believe the entire medical fraternity needs to integrate and share ideas to promote proper solution by assisting and providing affordable services to our community. We need to collaborate between private and public institution partnership to achieve this goal. We need to build bridges between public institution and the private institution for the sake of our community. Referrals, like we also need to actually get collaborated in terms of referral. And another example could be collaboration in research projects. We can share expertise and resources, training and education of KMTC and other medical students, funding assistance and different activities. All this can be done if we can actually sit together and cooperate and be able to create these bridges between the private sector and the public sector. The possible solution in areas of assisting elderly, for what we have been discussed, the MCA and the local chiefs need to come up with a policy on how some of these elderly patients can obtain their IDs card to get required services. We have majority of them out of these 646 pending, almost more than half, they don't even have ID. The NHIF office needs to integrate with social service and the county to advise and educate these elderly patients on obtaining an NHIF card. We need to actually educate them and make them understand the importance of this NHIF card. A committee should be established to ensure all of the above points are well addressed. Finally, we are humbled and wish to encourage all of you to support this project by volunteering, donating, or spreading the word. Every shilling counts, and your support are vital for the success of this project. In conclusion, we call upon the public government, we call upon the public, the national and the county government, partners and friends to support us in making this noble act a success story that will leave a lasting legacy. As we give our best to these elderly individuals, let us remember that it's not the years in your life that counts, it's life in your years. We believe that together we can make a difference in the lives of these individuals, knowing that today is them, tomorrow it could be any of us. We promise transparency about the funds that will be used, and we will share all cost breakdown after 1 year when we meet again. Thank you very much for listening, and God bless you.